our gynecologists specialise in the new adaptations and innovations in gynecological medicine in the treatment of a very problematic condition, which is treating menopausal symptoms relating specifically to the changes of lack of estrogen affecting the vaginal tissue and the vulval tissue. Now, most women are in menopause for up to a third of their life. Menopausal symptoms essentially start through the changes of the hormone metabolism, and principally the reduction and eventually loss of estrogen, which is a very stimulating and growth important hormone for normal gynecological rejuvenation and maintenance of healthy tissue. A lot of women become symptomatic of early menopause in their early sometimes, and usually mid to late 40s, and symptoms often persist well into people's 60s and 70s. So it's often said that women are in menopause and suffer from menopause for up to a third of their life. And as women are more than 50% of the population nowadays, it's a major gynecological concern. Now, the treatment of the lack of estrogen locally in these tissues of the vagina and vulva are a major concern, because estrogen is often contraindicated and not advised, and a lot of people are scared of using it because of its implications long term in perhaps stimulating breast cancer. And furthermore, a lot of women who have had breast cancer or are carrying the gene which predisposes them to breast cancer should not take estrogen. And whether estrogen is used locally in the vagina in the form of pessaries or cream, or whether it's used as an estrogen patch or estrogen tablets, or even an estrogen implant, they all carry the risk of predisposing to cancer. There's also a fear factor, so many women who haven't really got the predisposition are fearful of using any estrogen long term. And the issue is that estrogen needs to be used long term, because if the estrogen therapy, even topically on the vagina, is stopped, then the symptoms recur. So vaginal atrophy is basically a lack of stimulation of the normal metabolism or growth of healthy tissue in the vagina. So the vaginal wall, so this is the uterus and this is the cervix, and the vaginal wall has a certain thickness, and it relies on having a good structural strength of collagen and a well-hydrated, well-supported fluid matrix, which we call the hydration or the vaginal mucosal wall thickness. And as the estrogen stimulation of that is reduced, it becomes what we call atrophic. Essentially, the collagen support is reduced. The collagen are the protein structural fibres that give it its firmness and strength and circumferential volume, and also the interstitial fluid matrix, which is the fluid between the fibres, is not produced in the same quantity, so the whole wall becomes thin and eventually what we call atrophic. So you can develop scar tissue there, and it becomes often contracted, or because of its loss of strength, often it just dilates and becomes stretched. Now, the laser treatments are a new innovation. They've been used overseas for about 3 years, and in Australia now for about a year and a half. Here at the George Street Specialist Centre, we've pioneered a lot of their use, and we've been using it regularly, using 2 different laser types, which in fact achieve the same result. Now, the essential beauty of the laser is that you don't have to put estrogen pessaries in the vagina regularly, continually, every week and every year. There are simply 3 treatments, each taking a few minutes. There's absolutely no pain, no risks or side effects, and the results are almost too good to be true. They work effectively and consistently in everyone. Of course, there will be maintenance, but maintenance treatments are initially a quick 10-minute treatment every 3 months, and then eventually 6 months, and as the tissue, it depends on the age of the client, and it depends on the degree of deterioration of the vaginal wall thickness and strength and hydration when we first start the treatment, but eventually maintenance can be done probably once a year. We don't actually know that because these are new treatments, but we are conducting a long-term, statistically relevant trial on all of our clients, measuring the changes in the vaginal wall nature through ultrasound techniques, so measuring them scientifically as well as a patient questionnaire to review their improvements, and over the next few years we'll develop a lot more knowledge and be able to predict the amount of maintenance and quantify the improvement that's being made with these conditions. So it's in essence the two different laser treatments we use. Both seem to work equally effective. They're very simple and easy to use, and so far in all our trials they're working on everyone, and both our doctors, our gynecologists and patients alike are very satisfied with the results, and they don't require any regular daily therapy or any maintenance or any aftercare as far as the patient's concerned. So not only is there a lot of satisfaction with their patients, but because the vaginal mucosa and the vulval tissue is rejuvenated back to its earlier state, both the females and their male partners are able to resume a normal sexual relations, have much more sexual gratification, and we're getting a lot of family and social issues. We find our patients are reporting these are improved as well.